Hi friends, welcome to PharmaGrid. So today we are going to discuss some clinical pharmacy related questions, or else we can say that patient profile based or patient case based type of questions, because nowadays most of the pharmacy competitive exams are opting these type of questions. Okay, so I hope this series will be useful for all those who are preparing for any kind of pharmacy competitive exams. So starting with question number 1, a 28-year-old man with seborrheic dermatitis is prescribed a topical corticosteroid cream by his dermatologist in hopes of alleviating the chronic rash and erythema on the cheeks. Which of the following steps is most critical to achieve a therapeutic drug concentration in plasma? The options are absorption, distribution, elimination, glycosylation, metabolism. So here we need to find out the most most critical step that involved in achieving a therapeutic drug concentration in plasma. So here the correct answer is option A, that is absorption. Drug absorption from the site of administration, in this case via the topical route, allows the medication to enter into the skin and then into the plasma. Following this step, the medication can distribute into tissues and also be metabolized in tissues. Distribution occurs following absorption of the drug from the site of administration. Elimination involves removal of the drug from the body via urine, bile or feces. Glycosylation is not a step in the process of drug pharmacokinetics. Pharmacokinetics mainly involves absorption, distribution, metabolism and elimination. Metabolism of drugs occurs in the kidneys or liver after the drug has achieved adequate levels in tissues. So these all are the reasons why in this question the answer came as absorption, which is the most critical step in achieving the therapeutic plasma drug concentration. Next question. A 31-year-old man is brought to the emergency department complaining of dyspnea. Dyspnea means shortness of breath. He has a history of asthma and has had multiple asthma attacks requiring intubation for airway maintenance. He is non-compliant with his medications prescribed for this condition. Physical examination reveals this young man in acute distress. His room air oxygen saturation is 87%. In addition to administration of oxygen, immediate drug administration of albuterol should be administered by which of the following routes? The options are inhalation, intranasal puff meter dose, subcutaneous, sublingual, topical. So here we need to find out the immediate route of administration or immediate drug administration route for albuterol in this patient. So here the correct answer is option A, that is inhalation. This is because inhalation provides rapid delivery of a drug across a large surface area of the respiratory tract and is a route of administration of choice in a patient with an airway disease such as asthma. Intranasal puff meter dose would only deliver a small amount of drug to the patient and would not be recommended in this acutely ill patient. Subcutaneous administration is a slow route of administration and is not preferred in this acutely ill patient. Next is the sublingual route. Although allowing the medication to enter the circulation would be less preferred than the inhalation route in this acutely ill patient. Then topical administration would only achieve a local effect of a drug and is contraindicated in this patient. Third question. A 48-year-old man with end-stage liver disease is hospitalized on the intensive care unit. Review of his blood work reveals elevated liver function test to 5 times the normal rate. The patient is receiving multiple intravenous medications. Which of the following medications is likely to be therapeutic for this patient? Likely to be therapeutic in the sense which is not contraindicated or which can be used in this patient. The options are epinephrine, erythromycin, nifedipine, rifampin, verapamil. Here the correct answer is option A, that is epinephrine. So in this case, this patient has end-stage liver disease. The ability to metabolize medications through the cytochrome system of the liver is impaired. So the drugs that are metabolized in this fashion will not be properly broken down or metabolized and will accumulate to toxic levels. So epinephrine is not metabolized by the cytochrome system and can be used with caution in this patient. The remaining all other options, that is erythromycin, which is an antibiotic, then nifedipine, which is a calcium channel blocker, then rifampin, which is an anti-tubercular drug, and verapamil, which is also a calcium channel blocker. So all other options except epinephrine is metabolized by the hepatic cytochrome P450 system. So here the answer came as epinephrine. Question number 4. A hospitalized patient with systemic candidiasis is receiving intravenous antifungal medications. He also has hepatic and renal insufficiency. Which of the following drug administration schemes would allow for the most steady state amount of drug in the body over a 2-week hospitalization period where medication administration will be necessary. So here we need to find out the route of administration, route of drug administration that would allow for the most steady state amount of drug in the body over a 2-week hospitalization period. Options are continuous IV infusion, once weekly IV injection, single daily IV injection, twice daily IV injection, then twice weekly intravenous injection. So here the correct answer is option A, that is continuous IV infusion. Continuous IV infusion results in a less rapid influx of drug into the body initially. However, within a short time, a steady state of drug level in the body will be achieved. Although the drug level will achieve steady state, injection of drugs several times daily will result in higher drug amounts initially after dosing, but will decrease according to half-life. Then option B, it is wrong because once weekly IV injection will result in a peak and trough level of the drug with initially high concentrations and will decrease to almost no drug in the system. So peak and troughs are the highest and lowest concentrations of a medication in an individual's body. Then option C, which is single daily IV injections, it will result in lower amounts of drug in the body with the peaks and troughs. Then option D is twice daily IV injections. This option D is also wrong because these type of injections will result in the highest amounts of drug in the body but will also have peaks and troughs. Then option E, that is twice weekly IV injections, will result in higher amounts of drug in the body as compared with once weekly IV injections. So here the correct answer is continuous IV infusion. Question number 5. A 27-year-old man with HIV disease and hepatic insufficiency presents to his primary care physician complaining of rectal pain and bleeding with bowel movements. Physical examination reveals several internal and external hemorrhoids. The patient would like to avoid surgical therapy for this condition. Which of the following routes of drug administration would be preferred in this patient? The options are enteral, intramuscular, intravenous, rectal, transdermal. So here the correct answer is option D, that is a rectal route. So this rectal route is the drug administration that can be preferred in this patient. So in this case, this patient has hemorrhoids and a topical route of administration of medication is preferred. This route avoids the hepatic first pass effect, so the patient's liver insufficiency would not likely be problematic with this route of administration. Then the option A, which is known as the enteral route administration, will be unlikely to achieve an adequate therapeutic response in a patient with hemorrhoids. Option B, which is the intramuscular route administration, is an ineffective therapy for rectal diseases. Also option C, which is intravenous administration, it is also an ineffective therapy for rectal diseases such as hemorrhoids. Then option E means transdermal administration. This route of administration achieves systemic effects through systemic absorption of medication. It is not effective for internal hemorrhoids. So here the preferred route of drug administration is a rectal route. So we have completed today's question discussion series. Thank you everyone for watching this video. Please like, share and subscribe. Have a great day.